studies portion of their education. He did such an amazing job then that his class felt that he was best suited to capture the second half of their journey. The pressure's on, Daniel, but you've proven you can handle it. So ladies and gentlemen, I am pleased to present Mr. Daniel.
Faculty, friends, family, and especially the class of 2018. About a 15-minute speech prepared today, but really there's only one thing to say right now. We did it! And I think I just blew my voice for the rest of this, so bear with me. I'm honored to speak with you guys again today. It seems like only yesterday, but already it was 2 years ago that we were on the stage getting our white coats to signify our entry into the clinic. Gosh, that was fast. And it felt like such a big deal at the time. And it was, because that was the last time those coats were clean. But today is the day we've been waiting for, to wear these black robes in the hot Arizona sun. And there are no board scores haunting us when we get home in the mailbox today, so there's that. But really, we're here to celebrate 58 phenomenal physicians. The culmination of a week that we spent celebrating. Started with a pool party. There was a class brunch, class luncheon where we had some awards. Got our caps and gowns, took a class picture, and we participated in our medical school's most hallowed tradition, which is dressing like animals and banging a gong. But it's an amazing feeling to be here today, because this is really the hardest thing any of us has ever done. We earned this, you guys. We earned it. And we earned this many different ways. As Mr. Reed was saying, we spent over 4,000 hours in the classroom just since our last white coat ceremony 2 years ago. Medical and clinical science courses, 35 more of those, another 5 electives. And again, 1,300 hours, culminating, adding up to 4,000 over the 4 years. Now, a few of these courses were online. This was new, and guys, I'm going to need you to respond to that, 200 words or more, and then by Wednesday, if you can contact one of our classmates and reply to that, that would be great. But if you're counting, for our class total, that's more than 350,000 words alone that we spewed onto my SCNM. So, and I know some of you have been asking me, so I'm going to tell you, we're somewhere north of 50,000 PowerPoint slides now since we first started SCNM, and fortunately a lot of those were teaching us how to treat headaches and eye strains, so I think we're going to be okay. Second, we earned this through clinical work, hard work on our shifts over the last 2 years, 27 shifts. Each of us spent about 1,200 hours in the clinic, and collectively that's about 69,000 hours that our class spent. Now, we don't just show up and treat the patient, we spend an hour or two beforehand preparing, and thanks to Helios and to Picky residents, we spend another hour or two completing charts afterwards. So in total for our class, that's about 300,000 hours that we spent working with or thinking about our patients. And we saw about an average of 700 patients each over the last 2 years. And accounting for repeat visits, if you add that up for our class, that's about 30,000 patients. And as primary clinicians in year 4, we lead the cases. So that's about 15,000 patients that the class of 2018 saw and had an influence with. And I'm pleased to report, knowing our class as I do, that every single patient was cured on the first visit. It's absolutely incredible. All right, maybe that's not entirely accurate, but I'd like everybody to think about that for a minute. Dr. Mittman was talking about this earlier. You know, that's thousands of people in our community who we had an impact on their health and the productivity in their lives. Just our class. We also had a number of personal milestones to celebrate along the way. Just in the last 2 years since our white coat ceremony, we had 3 more weddings. We had Jake Chattel, Leanna Jagels, Rachel Ong, and we have 2 more this summer. Mitch is getting married in a couple days. Congratulations. And Faith Coates is getting married at the end of the summer, and that brings our total for this class up to 9. We also had 3 more med school babies born. Theo Jagels, Ruby Lynn Roth, Sage Shell, and we have another one about to be born to Samantha and Ryan Randall. It's going to bring our... So we had 8 babies total during our 4 years of med school. And 8, including Sky, was 8. So, and some of us also lost some close family members, some of us very recently. And we had to persevere because we knew that making them proud was the best way we could celebrate their lives. And I know they're here with us today in spirit, and they're in our hearts, and they're incredibly proud of us. And I know they're in this room smiling and beaming down upon us. Many of us also lost our adrenal glands. These are neither smiling nor beaming right now, so yes, we earned it today, and we earned it with gratitude. And on behalf of our class, I'd like to thank a number of people. First of all, our school administration and staff, for all the behind-the-scenes work you do to make SCNM, our experience at SCNM, efficient and allergy-free. And you are the ones we came to most in a state of agitation, and you kept us calm and you kept us focused. From class registration to student loans, clinical exam days, job counseling, you assist us in the clinic with blood labs and at the front desk. You keep the grounds on the campus safe and secure, and the computer gurus keep the Wi-Fi and internet humming so that we can do our jobs. We also appreciate Dr. Mittman and all those on the staff who promote naturopathic in our community so that we can get out there and practice. We appreciate you all and everything that you do. And to our attending physicians, residents, and faculty, you drove us crazy. You asked us question after question until we got it right, or cried. You made us question our sanity. You improved our clinical thinking, that's what I meant to say. More than anything, though, you made us better every single day. You shared your experience and your patience with us. Some of you run clinics of your own, practices outside of school, and you come to SCNM every day and let us treat your patients. Because you believe in us. You spend your time mentoring us. And each of you said that one thing on that one frustrating day that made our lives as new physicians, or that particular case, make perfect sense. You were patient with us, you inspire us, and you care about the quality of doctor that we're becoming today. We love you all, and we're also very grateful, and we're never going to forget you. Thank you. I also want to thank our patients for your belief in us. See you. I know there are a few of you here today, and I know also when you sign up for a student shift that it would be real easy to hang up the phone and go somewhere else, and you never do. Trust us. And I want you to know, on behalf of our class, this made us study a lot harder. We always want to do right by you. You made us know more than our attending physicians sometimes about your case. You taught us how to be ourselves. You taught us what we can be when we can be ourselves. You taught us how to gracefully make mistakes, how to be spontaneous in recovery of those mistakes and creative, and how to ask all the right questions so we can make you and then everybody else after you well. Serving you is the reason that we completed what we completed today. And it's the reason we're going to keep going, getting excited to get up every day and go to work, and to always keep going. Thank you, patience. Most of all, we're grateful for family. Talking about our families at home and our 2018 family, our family among each other. In his book, The Prophet, the great Sufi poet Khalil Gibran said, "Long were the days of pain I spent within its walls, and long were the nights of aloneness. And who can depart from his pain and aloneness without regret?" I think Gibran was in prison, but it always makes me think of school. Staying up late all by myself studying. But through all the hard work and sacrifice, we were never alone. To our families, you supported us. You supported us with your whole hearts on this crazy journey, and you were always rooting for us to succeed. There were plenty of days where we had setbacks, or where we were complaining too much, and we had discouraging thoughts, and you were there. When we had triumphs, you were there. And for those of us with families of our own, there were other sacrifices, times when we couldn't be as present as we liked, but you were there and you understood. There were also days where you simply just asked how we were doing on a phone call or when we walked at home, and we got so excited we launched into a bunch of fun facts on cardiology, oncology, pulmonology, whatever we happened to be studying that day, and we're really sorry for that. Hopefully not anymore. So, for all the boyfriends, girlfriends, wives, husbands, children, parents, aunts, uncles, thank you very much for your support. We can never repay you. And finally, to my classmates, the 2018, class of 2018 family, we made each other better for knowing one another, and even better for supporting one another. We made each other laugh through the hard times. We worked as teams in the clinic and in the classroom. And I have to say, while it's rewarding to lead your own case as a primary clinician in our clinic, some of the best feelings came in the secondary chair, watching each other lead and succeed. And I know our hearts are going to soar more for each other when we walk across the stage today than they might for ourselves. And really, there's not a lot more to say here, because I'll cry, and I'll make all of you cry. But we know what we've been through, you guys. We're always going to share this bond with one another, and we're going to be grateful for it. Thank you for being family. Now, I've got to be honest, I had some writer's block. As Dean Ken said, the last speech I did was pretty good. So trying to come up with another one to be the same or top that, I was trying to come up with some grand metaphor for what we've been through. And our classmate Allison Murky had the best one. She said SCNM is like the desert. She said, the desert is beautiful because everything in it adapts. The plants and animals that survive here adapt. They're meant to be here. Things in the desert thrive in the harshest environments because they're smart and they're creative and they persevere. Like Allison said, they adapt. A swirled cactus will fill with rainwater to nourish it through dry times. A diamondback rattlesnake will dig a hole to keep it safely out of the heat. A hawk will soar on a warm draft of air to conserve energy. Dr. Nick will wear a leather vest when lecturing. Everything in the desert adapts. And in 4 years at SCNM, we adapted too. We went through the seasons. We had summer and fall and winter and spring. We all came to the desert in the summer, 2014, year one. We were thrown into the heat. It was harsh. There were monsoon storms. We didn't go outside very much. And when we did, we were blasted by headwinds and left gasping for breath. You guys all know I'm talking about anatomy, physiology, biochemistry, microbiology. Then fall, year 2, the fever breaks. We knew our environment better. It wasn't so bad anymore. We had guides, dusty guides. Things started to look a little more interesting. Some classmates started to look a little more interesting to each other. And we started to feel confident in other ways. We started doing more hands-on physical medicine. We got our first taste of acupuncture, of botanical medicine, homeopathy, hydrotherapy. We reconnected with the reasons that we came to SCNM in year 2 and got just enough cool air and sunlight to enter the clinic and pass our first basic science boards. Then came winter, year 3. Fast gray days, long cold nights. It was just get through it and survive. We were secondaries in the clinic. We were looking pristine. Things were quiet. We had clinical science courses. We saw things now in stark relief. We had new clinical modalities to master. We had heavy workloads. We had a couple quarters from hell. Not seeing much light yet. Then spring, year 4, warmth. Primaries in the clinic. New energy, nourishment, encouragement, blossoming, hope, growth in places we never expected it, and gratitude for occasional rain. Full confidence, leading cases, and mastery. And now, here we are, it's about to be summer again. Going out on our own, guys. New heat, new board exams, preceptoring, residencies, helping a practice, maybe leading your own practice. These are new monsoon storms. So what now? What's the future? If I can sum it up, I will do so in 2 words. Chronic disease. It's true, and I'll tell you what, chronic disease is our new desert, and it's a national crisis. You may know it by its other names: heart disease, cancer, type 2 diabetes, Alzheimer's, arthritis. There are many other names. In all, 7 of the top 10 preventable conditions and leading causes of death in this country are from chronic disease. The Centers for Disease Control estimates, it says that chronic diseases are the most costly and the most preventable of all health problems. How costly? 86% of our nation's $2.7 trillion expenditures on healthcare go for chronic and mental health conditions. In fact, we spend $1 trillion alone, $1 trillion on just the top 5 preventable conditions. So it begs the question, if these chronic conditions are so preventable, shouldn't all these costs be closer to 0? No, not yet, and I'll tell you why. Because we have a mismatch of acute and chronic care. If you have an acute event, if you have an emergency, our hospitals, our surgeons, our pharmaceuticals will fix you. The trouble is, if you have a chronic condition, our acute care system will use acute care methods. And this often suppresses the problem, and it can create other costlier ones. Fortunately, nobody treats chronic disease better than naturopathic physicians. Why? Because we're the doctors who spend time with you. We're the doctors who listen to you. We're the doctors that seek to eliminate the root cause of your illness. We're the doctors who respect and stimulate your body's incredible ability to heal itself. We're the doctors who actually partner and teach you how to manage your health. In fact, the root word of doctor is docere, which means to teach. And in fact, the root word of physician is physic, which means natural science. So physicians are healers that use natural science. Hey, that's us. We're doctors who use the most natural, least invasive, least toxic therapies. Yes, drugs and surgery are considerations, but they are typically a last resort, not a first line or only line of treatment. We're doctors that treat the whole person, not just your symptoms. In fact, it was Hippocrates who said it is more important to know what sort of person has a disease than what sort of disease the person has. In other words, naturopathic physicians will treat you like a human being and employ common sense. That said, it's not our job to solve the problems of healthcare, but it will be our jobs to partner and promote and perpetuate its solutions. Naturopathic medicine, it is a great solution. In fact, for those coming up on stage today to get their diplomas, I would say it's a $1 trillion opportunity to serve our communities and make the world well. Because, and I quote, people are beginning to realize it is cheaper and more advantageous to prevent disease rather than to cure it. One of the earliest proponents of evidence-based naturopathic medicine, Harry Lindlar, spoke those words more than 100 years ago. This means that the class of 18 is not just the future of medicine. The naturopathic physicians in our community are not just the future of medicine. We are all the long overdue future of medicine. And I've got 58 new physicians with me here today who I can guarantee will prove this to you. When it's time, come see us. Come partner with us. You have no idea how good you can feel and how easily we can make that happen with the healing power of nature. Because today and forever, we are naturopathic physicians from the desert. Thank you very much.
It will be my honor to introduce our keynote speaker. But before I do that, I want to preface my